Hello, hello, hello. Welcome to the live broadcast. Hello, hello. How's everybody doing today? Come on in, come on in. Today we are broadcasting with the help of a 3-year-old, and we are talking about Chemo Brain. All right, buddy, aka brain frog. Here, brain fog. I'm Dr. Melva. Come on into the broadcast. Come on in. You want to help me, buddy? Come on. Put that down and come help me. You can come help me, okay? Come on. All right, let's put the top on this marker. Come on in, come on in, come on in, come on in, come on in. All right, so we have a helper today. Say hi to everyone. Hi. You have marker on your hand. Okay, welcome to the live broadcast. Thank you so much for joining. I am Dr. Melva. We are broadcasting live from where? From our house in Chesapeake, Virginia. Chesapeake, Virginia. Welcome to the live broadcast. I have with me Leland. How old are you? 3. I have my 3-year-old partner today. Today we are broadcasting live from Chesapeake, Virginia. Yes. Okay, let me tell them what we're talking about today. Today we were talking about Chemo Brain, aka brain fog. Today we are talking about Chemo Brain, aka brain fog. If you know anyone who can benefit from this, have them share, and have them come on and join the live broadcast. Let's see who's joining us. Thank you for watching. So I'm Dr. Melva. I'm your Board Certified Radiation Oncologist, and this is my son Leland. Say hi, Leland. Hi. And together, we help patients that have been diagnosed with cancer through my videos, speaking, community cancer centers, and programs. I help them to overcome obstacles that are stopping them from getting treatment, living their lives, and navigating the cancer care system. You can find me right here on facebook.com/doctor, spelled out D-O-C-T-O-R Melva, M-E-L-V-A. All right, buddy, let's get into it. All right, so welcome to the broadcast. We're broadcasting live. Today is Thursday, September 14th at 6:30 p.m. Eastern, and we're talking about 8 tips on understanding and dealing with Chemo Brain, aka brain fog. All right, so as anybody out there, any patients that have been diagnosed with cancer, have received chemotherapy treatment, ever had what's referred to, or have you heard of Chemo Brain or brain fog? Well, this comes up a lot in the cancer care field, and I wanted to talk about it, help you to 1, understand the signs and symptoms of Chemo Brain, and 2, give you some tips, practical tips on dealing with it. Does that sound good? All right, let me know you're here. I can see when people are joining. Say, hey, Dr. Melva, we're here and we're ready to learn.
I'm ready to learn.
You're ready to learn. All right, thank you, Leland. Thank you. Tell them they have to type that in. Type it in. Type it in, yeah. Say, I'm ready to learn.
I'm ready to learn.
Ready to learn. All right, so you've heard it from my 3-year-old. All right, so let's go over a couple facts. So we have our notes here. So up to 75% of patients that are treated for cancer will experience some form of cognitive brain problem, aka chemo brain, brain fog, getting a brain fog myself. It can also happen to busy moms, especially of toddlers, if anyone out there could understand. So what are the symptoms of chemo brain? You may hear about it, you may have experienced it, but what does it mean to have chemo brain? So what it means is that you may have word finding difficulties. So you know what you want to say, but you just can't get the word out, right? And are you tired? You may have a problem to do what I'm doing here, multitasking. So multitasking. Can you say multitasking? Multitasking. So you may have a problem, let's say cooking dinner and talking with the kids, or you know what multitasking is, right? You may have a problem keeping up with the points that you want to ask in your doctor's visit about notes you need for work or questions you have about your chemotherapy, radiation, or surgery treatment, but you just can't do more than one thing at a time. These are signs and symptoms of chemo brain or brain fog. If you're just joining me, I'm Dr. Melva, your Board Certified Radiation Oncologist, and we're talking about identifying chemo brain or brain fog and ways to deal with that. Why do you have that face? Okay? Can you say chemo brain?
Chemo brain.
Chemo brain. Okay. So the signs of chemo brain, again, are difficulty word finding, inability to multitask, which is my life, Short-term memory problems. So the most common example I give for short-term memory are where you put your keys. If you cut the stove off, if you're cooking, just things that just happen. It's not usually long-term memories like when your kids were born or who you married or where you were born. Those memories are very different than what we forget short-term. Welcome to the broadcast. Welcome to the live broadcast. Thank you for joining. We're talking about chemo brain and brain fog today. We're understanding what that means and giving you tips on handling that. So far we've talked about the symptoms, which include word-finding difficulties, an inability to multitask, short-term memory problems, and the last one is difficulty concentrating or short attention span. It's kind of good that I have my 3-year-old on here because he can understand short attention span. Can you say short attention span? Short attention span, right. So you may notice these things. Hello, hi Dawn, welcome to the broadcast. Thanks for joining us live. You may notice these symptoms after a course of chemotherapy. Now, one thing that I'll switch, I'm calling this chemo brain, but actually what we found is that chemo brain or brain fog can actually be caused by several different things. So should we go over with them what can cause chemo brain? Yes. So yes. Yes. Okay. So things that can cause chemo brain. So obviously chemotherapy, hence the name, but also what I deliver as a radiation oncologist. Radiation therapy can cause brain fog is really a better word for it. Also hormonal treatment. So if any men are getting treatment for prostate cancer in the form of anti-estrogen or anti-testosterone treatment, a type of hormones, that can cause chemo brain. Poor sleep can cause chemo brain or brain fog. Stress can cause chemo brain or brain fog, and then different medications can cause chemo brain or brain fog. Okay, so those are the things that can cause chemo brain or brain fog. We've talked about the symptoms of chemo brain fog. Do you have brain fog?
Yeah.
Yeah, you have brain fog. So things that are difficult are to multitask, short-term memory problems, inability to find the words that you want to use, and things, again, that can cause chemo brain, chemotherapy, hormone treatment, radiation treatment. Thank you for joining the live broadcast. Welcome, welcome, welcome. Poor sleep, stress, and different medications. All right, so we've defined what chemo brain is, what can cause it. Now let's talk about what to do for it. Does that sound good? Thank you so much for joining. I hope you're getting value from this. Those of you just joining me, I'm Dr. Melva, your Board Certified Radiation Oncologist. I help patients who've been diagnosed with cancer navigate the cancer system. And this is my partner today, Leland. Say hi, Leland.
Hi.
And what are we talking about today? Brain fog.
Brain fog.
Brain fog. All right. So we've defined brain fog. We've talked about the symptoms and how you get it. What can you do about it? So number one, just time. So time from the end of your treatment, whether radiation, hormones, or chemotherapy, will help you return back to normal. So normally within 6 to 12 months, can you say 6 months?
6 months.
And then 12 months.
12 months.
12 months. So between 6 and 12 months, with no treatment at all, no intervention, you begin to return back to baseline before you ever had chemo brain, okay? So just time sometimes. So sometimes you have to be patient. Now, what are other things that you can actually do physically? So number 2, everybody's favorite, say exercise. Exercise. All right, so aerobic exercise helps to, 1, fight fatigue or tiredness, which helps your brain with higher level cognitive functions. It increases your mood, and all of these add to helping with chemo brain. All right, number 3, managing depression and anxiety. This one's a little bit harder to do. You definitely want to talk to your doctor about managing depression and anxiety. Okay, say manage depression. Manage depression. How can you do that? With therapy. Say therapy. Medications. Medications, and say mind, body. Exercise. Okay, so exercise is very important. Either aerobic exercise or mind-body exercises that you can talk to your doctor or psychiatrist about for managing depression and anxiety. Okay, so just to run through things again, we're talking about chemo brain or brain fog today. I'm Dr. Melva. We're broadcasting live from Chesapeake, Virginia. 3 ways to combat brain fog. So 1, just time. Your cognitive ability, your ability to word find, multitask, have short-term concentration should return just within 6 to 12 months of your treatment, sometimes with no intervention or treatments. Number 2, aerobic exercises increases your mood, and it also helps you to combat fatigue or tiredness. Number 3, managing anxiety and depression. This can be done with therapy, so consult your doctor, medications, mind-body exercises. All right, buddy, we're almost halfway through. Do you want to give them some more tips? Yes. Okay, so tell them tip number 4.
Tip number 4.
Tip number 4.
Tip number 4.
Good job. Tip number 4. All right, talk to your doctor. Sometimes you may have chemo brain because of other reasons that are unrelated. Okay, that are unrelated to your treatment. Okay, so you have to rule out if you're taking any other medications. You have to be quiet while I'm talking, okay? Okay, thank you. You have to rule out if any other medications are causing you to have chemo brain. And then you may need lab work. Can you say lab work? Lab work, okay? And with blood work, you can look to see if some of your numbers are out of whack. Sometimes your thyroid can be too low or too high. This can affect your brain function, as well as other blood counts, okay? Do you want to sign off for today?
Yeah.
Okay, well, tell them bye-bye. Mommy's going to wrap it up, okay? Bye. Thank you so much, Leland, for your help. All right. So talking to your doctor is tip number 4. Whew, that's a lot of work. So tip number 4. Number 5, sleep. Poor sleep can cause cognitive challenges. So you want to be making sure you get enough sleep. Hey, you said bye-bye. You got to be quiet, okay? Oh, my goodness. Thank you for just joining me. If you're getting value out of this, let me know. Let me know. We're going to get through this and wrap it up. It's me and the toddler today. All right, so number 5 is get some sleep. That's easier said than done, but there are lots of ways, and we can do a separate live on good sleep hygiene. Number 6, get organized, okay? When you have short-term memory loss, difficulty word finding, and chemo brain, the more organized you are, so as far as using a calendar for your appointments, it's decreased work that you have to do for your brain, okay? Number 7, don't multitask. I put the kid down. I can't do multiple things at once. So if you have chemo brain or brain fog after radiation, chemotherapy, or hormone treatment, stop trying to multitask. Focus on one thing. All right, and number 8, this is a much newer model of study, but cognitive rehabilitation is something that you should ask your doctor if you're a candidate for. So there are different therapies that you can do for brain function to help you. All right, friends, I hope that you learned something from today. We had Leland, my 3-year-old, helping me out. I hope you got value. Just to wrap this up, I'm Dr. Melva, your Board Certified Radiation Oncologist. Today, we went over 8 tips on dealing with chemo brain and brain fog. We talked about what it is, and we talked about 75%, up to 75% of patients who are treated for a diagnosis of cancer. Hey, Marie, thanks for joining. Up to 75% of patients that are treated for cancer experience some type of cognitive problem, aka brain fog. So I hope that was helpful for you today. Any questions for me? Are there any questions from anyone who's joining me right now? If you're getting, let's read the comments, see what they say. Trisha says, hey, Doc. Hey, Trisha, thanks so much for joining. Please let me know if you have any questions. Hey, Monique Gray, how are you doing? Thank you so much for joining. All right, Trisha says, yes, train us. Trisha says, yes. Thank you so much for joining the live broadcast. And I don't know if she was saying yes at the time that I asked if you've had brain fog. So are you a patient? Have you been treated with radiation or chemotherapy? Had brain fog? Are these helpful tips? Let me know. Reading the comments, just looking through here, seeing who joined us. All right. So just to go over it again, we talked about brain fog. Please rewatch the replay, share. I know that these tips will help a lot of people. It's not fun when you have chemo brain. It's not fun when you have brain fog. And sometimes, like we said, the best would be that it goes away within 6 to 12 months after treatment. Hey, Tricia says brain fog, helpful tips. Excellent. All right, so you're saying you had brain fog. Great tips. I'm glad that those were helpful. All right, any questions for me? Any questions for me? Thank you so much for joining the live broadcast today. Thank you for, tolerating me multitasking with the 3-year-old toddler here. All right, any questions for me or for my co-anchor here? Let's see if they have any questions for you, buddy. Come back. Let's see. What are you getting into over there? Let's stay out of the book. My daughter's at softball practice with Mickey Mouse. We're not talking about Mickey Mouse. What are we talking about? Brain fog. Say brain fog.
Brain fog.
Brain fog. And say another reason for brain fog are toddlers. Okay, we have marker all over our hand. All right. Well, I hope that you got value out of today. Again, I'm Dr. Melva, your board certified radiation oncologist. I help patients that have been diagnosed with cancer through my videos speaking community cancer centers and programs. Find me right here on Facebook.com/Dr. DOCTOR Melva. Until next time, say bye.
Bye.